Today's World Cancer Day, and I thought I should spread awareness on this topic, cancer. According to the World Health Organization, 9.7 million people lost their lives to cancer in 2022. 1 out of 12 women lose their lives to cancer, and 1 out of 9 men. And it is also estimated that 1 out of 5 people will face a cancer diagnosis in their lifetime. However, there's a very disturbing aspect, which is the reason why I'm making this video. This is a very traumatizing projection that the rate of cancer will increase by 77% by the year 2050. If nothing is done in this current environment, continuing with the eating patterns, continuing with everything that is increasing your risk of cancers, we are all going to suffer more pain from this chronic health condition, cancer. Lifestyle can actually prevent up to 40% of cancers. And that is what we are going to be talking about today. How to prevent cancer. What part do you play? You know the way we are going, for sure. So instead is even an underestimation. So what are the things you can do so that we can reverse the burden of cancer on us as a community and as a society? The first most important aspect is avoiding smoking. Whether it's tobacco, whether it's shisha, or whether it's anything smoking, whether it's illicit drugs of cancer, this has been proven to reduce the risk of chronic inflammation, which also reduces the risk of cancers. Let's look at our food. Are we still going to continue eating the ultra-processed foods, which have been proven to increase the risk of cancers, while hoping that we do not develop cancer in the process? Really? We need to let go of all these ultra-processed foods. We need to let go of all these high-sugar foods. We need to let go of all these drinks. We need to let go of alcohol. These substances are causing us cancer. We need to let go of them. And we need to embrace more of plant-based diets. We need to embrace the Mediterranean. We need to embrace the whole food plant-based. Whatever things you're doing, you need to embrace a more natural diet. A diet low in sodium, low in trans fat, low in saturated fat. A diet high in fruits and vegetables, because these substances, they have phytochemicals, they have vitamins, they have many things that have been actually shown to instead fight cancer. So if you're fighting cancer, you need to fight with your fork, with your spoon, with your knife. We are going to fight it with the things we are putting into our bodies. The next thing we'll talk about is alcohol. I still wonder why alcohol is legal. I still wonder why policymakers make alcohol legal, because alcohol is linked to so many kinds of cancers. So at your own individual levels, can we switch to water when we are thirsty? It doesn't matter the form of alcohol, whether it's red wine, white wine, beer, it doesn't matter. 0 is the same limit for alcohol. And then other factors like sleep and stress. We need to manage these factors regularly. When it comes to things like vaccinations, HPV vaccines, when it comes to things like routine screenings, routine breast exams, we need to ask our doctors and carry them out as per our age as required. Stop waiting to get sick before you go to consult the doctor, because that's how we learn ourselves with everybody developing cancer. If you are a man above the age of 40, you need to get your prostate assessed every year, either through a PSA, that's a prostate-specific antigen test, or through a digital rectal exam by a doctor. If they diagnose anything, whether it's benign or carcinogenic, they're going to determine the best way forward for you from there. But earlier, the better. The lifestyle change, quitting tobacco, quitting alcohol, eating more healthy foods, quitting the processed foods, and also carrying out screenings and doing vaccinations. That is how we get ourselves free from cancer. Now, this is to all those who are currently struggling with cancer. I understand the difficulties you're going through. I understand the challenge. I understand the anxiety. I understand the difficulties that might accompany a cancer diagnosis. Because as a doctor, I've had to walk patients through that road as well. But this is what I have to say to you. There are so many things that can help to boost the treatment process. Aside from radio and chemo and all of that, what are you eating? Are you continuing to drink from a poisoned well while you're on treatment? Because you need to change the things you're eating. You need to boost those lifestyle habits so it can better enhance the other treatment methods that you're currently going through. Not just going to improve your chances of treatment, but even reduce your chances of reoccurrence of these cancers once you're treated. For those who have a family member dealing with cancer, Be supportive. Support them through this lifestyle change as well as you support them through conventional treatment options. Support them through healthy lifestyle changes. They cannot continue to practice the things that increase their risk of getting the conditions while they are sick. And if you also come from a family of people who have cancer, there are certain genes that run in certain families that increase your risk of developing certain cancers, right? It's very important for you to carry out your routine screenings. It's very important for you to change your lifestyle now while it's still early. It's very important for you to not wait until you have a lump before you go and get it checked. It's very important for you to get informed. Talk to a healthcare provider. As a community, we can prevent this frightening estimation of cancer rates increasing by 77% by 2050. I can't do it alone. You can't do it alone. We have to do it as a community. Healthcare system plus workers plus the population plus the media outlets plus everybody. Join your voices together to support cancer survivors, to promote healthy lifestyle practices, to prevent cancer. I am Dr. Patience, a medical doctor and a health coach using lifestyle medicine to transform lives. For cancer survivors, lifestyle medicine has a huge role to play in your treatment. Do not overlook it. Talk about it with your healthcare providers, and I wish you the best on your treatment journey. I hope this helps you make informed decisions. I hope this helps you not just protect your life, but also save others.